So Macmillan in June of this year have signed off and are about to launch, and you're going to hear us talk about our new 5-year strategy, which we are all very, very excited about. So there are a number of different strands, but specific to nursing is our workforce engagement programme, and developing a workforce which has skill mix central to that, where we have investment in developing the clinical nurse specialist workforce and the support worker workforce, where actually we develop the allied health professional workforce, and all of that is going to be done in a way that actually we historically haven't always operated. So for example, we may be investing in posts, or we may be developing those relationships and our learning and development offer to make sure that people have the skills and the competencies required to deliver quality cancer care. The other area which I find really exciting in our 5-year strategy is really looking at transition points and being relevant for people from that point of diagnosis. So when we did some evidence and insight work, and we asked people in the general public what they thought Macmillan was there for, they didn't generally think Macmillan was there for them. Macmillan was there for people who were in desperate states and who were in crisis, but not necessarily there for them. So our message is that Macmillan is going to be there for everyone from that point of diagnosis, and to have what we're calling a wraparound care right by you that will help support them right the way through their treatment and diagnostics and right the way through to recovery. And then for people who are treatable but not curable, so people who maybe is at the point of diagnosis or recurrence, at the point of recurrence of their cancer, cure is not going to be an option. So this is an unknown group to us in many respects. So we really need to understand more about the patient population who are living longer and who might not be living very well through consequences of both the cancer and treatment, but might be living for months, years, decades even. And we need to understand more about that patient population to think about and to understand how can we help them, and how can we actually, and again another part of our strategy is to move that support into community and primary care. So if we can understand that population, we can then think and develop services that are actually present and relevant to people within community and primary care services. So we're going to be working with our health professionals in a very different way, and developing those relationships and those communities, developing what we're calling an affiliate offer for practice nurses. So again, there's a lot of really exciting stuff within the strategy. I haven't mentioned end of life. End of life care is incredibly important as people transition from treatable but not curable into end of life. And we really want to develop early intervention palliative care services that are fit for purpose, because we know pain and symptom management are still a problem for people who are affected by cancer. So again, our end of life offer, working with our NHS partners and our other charity providers, is going to be a critical part of how we support people who are affected by cancer.